The best way to look at the coalition is as a statewide network of advocates. So we have members and board members throughout the state, many of whom also represent various organizations. And that's very important because really having this broad-based, diverse group of members and diverse involvement in our policy goals helps to create leverage for change.
The Missouri Coalition for Oral Health is an evolving network of oral health advocates, partners, and stakeholders located throughout the state with the mission of improving the oral health of all Missourians through sound public policy and public awareness.
There's a lot of broad-based people in there, not only dentists and hygienists, but there's folks from mental health and other areas across the board, aging. They all have some interest in improving oral health in the state of Missouri.
It's been exciting to see the development from what was basically a startup agency to what's now a very vital network of organizations and individuals, and that have accomplished a lot to improve Missouri's oral health.
Since its restructuring, the coalition has really become much more of a force in terms of influencing health policy, influencing the delivery of care, access to care, and I think it's been a really positive impact in Missouri in terms of oral health.
The coalition, I think, has done a great job to help raise awareness of some of these issues related to oral health or lack of it for a number of people.
I strongly support the coalition and its mission. It ties in with our mission at Delta Dental to improve the oral health of the people in Missouri. We will continue to work hand in hand with them to bring better opportunities, remove barriers, and provide better oral health to our community.
This kind of gives us a place where we can gather and talk through issues and find that common space in those policy issues that we can all agree to, and then go to the Capitol and advocate for them together.
As a healthcare professional, I think one of the most important things to be is an advocate for your patients. So being a part of a coalition definitely helps you become an advocate.
As a dental hygienist, I see the ramifications of poor oral health every single day. So trying to improve that health is really important to me, because I know that if oral health is good, people's total health will be much better.
Missouri oral health is important to me because I see so many people with disabilities that do not have access to much needed basic oral health care. When I was young, it was necessary for me to take medications that caused damage to my teeth and gums, so I have experience with ongoing oral health issues. Had I not been part of a family that was able to access good oral health care, I would probably not be here speaking with you today.
A lot of people just think, well, you know, it's just teeth, but it gets pretty complex when you think about other health systems. You think about self-esteem, ability to even make a living. Oral health has an impact on all that.
I like to say that we've built momentum around oral health policy and addressing the oral health challenges of Missouri. And those things include establishing an oral health caucus in the Missouri legislature.
And I'm very excited because the chairperson of that caucus is a dental hygienist who is Representative Donna Lichtenegger, and she's been able to get speakers and be able to use her own influence as an oral health provider to move some of the policy agenda items forward.
I actually thought that it was kind of my calling to start an oral health caucus. I realized very early on, being up here, that there are many, even state representatives and senators, that didn't know a lot about the subject. And I felt like this was a way that I could still not only serve my constituents with the workings that goes on in the House of Representatives, but also within my field.
We also did not have an appointed dental director in the state for over 10 years. We worked to get someone back in that position.
And to be able to get someone who can always talk about oral health and it's important to total health and all the conversations is a big win for us.
You are bringing oral health and the importance and what it means to the community and to the people in the state of Missouri. You know, it's bringing that to light.
We've had fluoridation notification. It was finally passed in 2016. Again, that's Representative Lichtenegger's.
If fluoride is going to be removed from the water, there would be proper notification, and then we could go to the public water systems and explain to them the importance of fluoride in the water systems in the state.
Historically and through research, we know the benefits of fluoride. And being able to provide that fluoride on a population base in the drinking water is a strong benefit for all individuals in Missouri.
Probably the biggest thing we've done, though, is adult dental.
One of the key victories for the coalition was reinstating Missouri Health Net adult dental benefits in early 2016.
We've worked for a number of years to get that reinstated. Fortunately, we've had a lot of supporters, and we did get it put back in the budget and finally implemented this year.
This reinstated benefit impacts over 200,000 adults in Missouri, and we have experienced broad bipartisan support and commitment to the reinstatement of adult dental benefits.
It has been extremely exciting that we've been able to see these patients that have started to have dental benefits again. A lot of them are very thankful, very grateful that they have their coverage turned back on, and many of them are coming in saying, I haven't seen the dentist since it was discontinued in 2005. I haven't been that long to the dentist, and I wanted to make sure I got in right away.
I work in a rural community in southeast Missouri, and I've been able to provide dental hygiene services to patients that have went without dental care for a long time because they couldn't afford it. And now that they have some financial assistance, they can come in and get some of these issues taken care of, and even take advantage of coming in on a routine basis and just, preventative care.
While this bill does not come close to addressing the state's need for adult oral health care, it is a step in the right direction, and just as important, it is a public recognition of the need for these services.
We know that certain segments of the population have particular challenges. So if you're low income, it's going to be very hard for you to find and to afford oral health care. If you're in a nursing home, you're probably not getting good, regular oral health care that you should be getting.
What I see as the biggest oral health challenges in Missouri is tooth decay. I mean, we have the leading childhood disease in America. It is 5 times more prevalent than asthma and 4 times more prevalent than obesity. This is a huge epidemic, but it is also the most preventable. All we need to do is find the right combination of education, treatment, and advocacy.
One of the biggest challenges that we face is that there's really low access to oral health insurance in the state of Missouri and nationally. So we know there's a big problem of people being uninsured for their medical care, but it's just 10 times worse of a problem when we're looking at oral health care. And unfortunately in 2005 in the state of Missouri, the Medicaid program cut out the adult dental benefit, and the coalition was able to get that reinstated. So that's a definite step in the right direction, but the challenge remains that there's a lot of people with poor oral health and a lot of work that remains to be done.
Some of the larger challenges that Missouri faces in regards to oral health are underserved populations, our children in particular. We're very concerned about the decay rate in the children in Missouri.
Do patients have adequate access to care? Do we have enough providers in the state? Do we have enough facilities set up for patients to go? So we look at access, but then we also look at not only the demand, but do we have places to send all of these patients?
The state of Missouri has a lot of problems when it comes to oral health, mostly because we have a lot of rural space in the state, and we have very few dentists that work in some of these rural counties.
When you go out into California, Missouri, Glasgow, Missouri, Fayette, you have all these little towns that they don't have access. It becomes a transportation issue. I mean, they might want to go to the dentist, but they don't have the resources to get to a dental professional because it might be 30 minutes to an hour away.
Particularly in rural and some underserved urban communities, we just simply have an absolute lack of dentists, of dental hygienists, and that makes it very difficult to expand access.
We have more dentists retiring each year than we do graduating from school. So I think we really need to do a better job in investing in the education and cultivating students to go into dentistry and hygiene.
We have actually 5 counties in the state of Missouri that have no dentists. We have 99 counties in the state of Missouri that are what are called health professional shortage areas for dentistry. So we have a real access problem.
Some of the biggest oral health challenges really come in terms of the funding for oral health care in our state. It has been something that has been an issue for many years. The legislators understand the importance, but when revenues aren't there, it seems like oral health care is one of the first things that is on the chopping block.
Dentistry is still viewed by many as primarily a cosmetic issue. I believe our biggest challenge is getting our society and our medical service delivery system to recognize that we cannot continue to try to make our mouths and our bodies live in 2 different worlds.
When dentists, especially those in rural areas, do not accept Medicaid, it limits the options for individuals to seek preventative care. Therefore, people who seek treatment wait until it's really an urgent need and head to the emergency room.
To have more Medicaid providers in the state of Missouri, and that can be accomplished by first increasing the reimbursement rates. And I think more providers will be likely to sign on and sign up to provide care to the underserved.
So really it's all about keeping people healthy, keeping people in a more cost-effective setting to receive services, trying to keep them out of the emergency room where it costs significantly more and they really only get palliative care, just treating the pain, and getting them into a dentist chair to take care of their oral health needs.
I also think just being a voice at the table is going to be really important in the coming years. There's a lot of healthcare work that's moving towards integration and integrating mental health and physical health, and having a voice to represent oral health at those tables is going to be really important. And absent the Missouri Coalition for Oral Health, I don't think we would have that.
It's a very unique group, a very enthusiastic group, a lot of energy, and there's a lot of opportunity there to make a difference.
I've seen people from all different walks of life come together while with the desire to improve oral health care in Missouri. When we worked together, we were able to determine key concerns, put a plan into place, and see results. This is the goal for every advocacy organization, and Missouri Coalition for Oral Health really delivers.
The organizations and the oral health care stakeholders in the state have really come together, and so it's exciting to think about what we can do in the future.
I am excited about the opportunity to start next year's legislative session with both a state dental director and an oral health caucus in place.
Some things that we will continue to focus on is continued funding for the adult dental benefit through Missouri Medicaid, and also the coalition is committed to addressing oral health equity by advocating for increasing access to care for all Missourians.
And next year I'm really hoping that we can advocate for more coverage for more adults and add in some new policies that would extend access to care through things like teledentistry.
There is also new legislation in regard to telehealth that allows for the development of teledentistry. Teledentistry is a very innovative approach to accessing dental care for Missourians in underserved areas, in particular rural areas.
We help become that voice for people who don't have a voice themselves.
The Missouri Coalition for Oral Health has become statewide an organization that is looked to for leadership, and it's making sure that oral health is expanded, access is expanded, and the overall health of the citizens of Missouri is improved.
It's surprising to me how enjoyable this work is. It's hard work, but it's also extremely fulfilling when we get some wins that we know are going to help Missourians have better oral health and be able to go to school ready to learn and go to work ready to work. And we're very happy about that work. I think we all feel good about the work, and I certainly do.